Before you start attending a therapy or support group, do me and yourself a favor. Watch this video. Hey, I'm Dr. McCleary, licensed clinical psychologist and Navy veteran, and I make mental health videos for veterans and their families. In this video, I'm going to give you 4 tips to make your group therapy experience a lot easier and a lot more effective. And we're starting right now. So my first tip for you is do your homework. Yes, often group therapy, just like individual therapy, requires that you do some work in between sessions. And think about it this way. Let's say you're in group or in even individual sessions, 1 hour, maybe even 45 to 50 minutes, maybe it's even 90 minutes, so an hour and a half. That still is a very small amount of time. So I'd argue that the real work gets done outside of session, because that's when you actually have to implement the skills that you learned. If you want to call it exercises or practice instead of homework, because the word homework has a bad taste in your mouth from some past experience in school, fine. Whatever you want to call it, just do it. If you're getting value out of this video, go ahead and smash that like button. Or, more important than that, share this video with another veteran. My next tip for you is to check your ego at the door. And what I mean by this is try not to fall into the hierarchy of my pain or my suffering is worse or more important than anybody else's pain or suffering. When you find yourself comparing and trying to put people in different categories based on their trauma experiences, their life experiences, or their just general pain, it's not going to end well for anybody. My next tip for you is to participate. Yes, actually participate, answer questions, add your comments, add your experience. This is one of the harder ones to do actually in group, but it's honestly also one of the most important. Often what makes the group therapy experience so powerful is not just the knowledge of the group facilitator, but actually the knowledge of the different group members, their experiences, how they are tackling issues, how they are experiencing maybe similar issues that you're experiencing. The amount of healing that takes place in groups because of just those things, without the therapist, without the psychologist, is part of the power of group therapy, especially with veterans. Because let's be honest, we don't always trust people that aren't veterans. I'll take this one step further, and I'll actually give you a personal example of why participating is important. So when I was getting my master's degree some 10 plus years ago now, we used to do these kind of yearly or bi-yearly, I can't really remember, evaluations. And I always made good grades. But the feedback that I started to get from my professors was, hey, you never say anything in group, or you never say anything in class. And my response was usually, so? I have an A in your class, so what's the problem? The problem was I was the only veteran in class. Sometimes I was the only or one of few minorities. Sometimes I was the only man in class. And the feedback was that people actually needed to hear what I had to say. They needed to hear about my experiences. They needed to hear how I took things from a different lens. And I realized what I was doing is I was actually robbing my peers of that experience, of that ability to learn from somebody who had a different background than them. I took that to heart. And now it's one thing that I do, whether I'm supervising younger therapists or just with my peers. I make sure that I educate them about military and veteran culture. The last tip that I have for you is to remember why you're actually in treatment, why you're actually in group. And that's for you. Why this is important is because either if you're active duty or you're a veteran, a lot of the culture in the veteran community or the active duty community is you're a big part of a team. Okay. Well, I know I just said you want to participate, so everybody in group also gets to learn from you. However, what you don't want to fall into is a trap in which you are trying to take care of everybody else in group and not take care of yourself. There has to be a balance. And what we can often do, and this is a form of avoidance, we can help other people out and we can never talk about our own stuff. That's the trap. So the tip is focus on yourself because you're the mission. If this video was helpful for you, go ahead and like it or consider subscribing to my channel if you want to learn more about PTSD or mental health. But more important than that, if this video was helpful for you, well, that means that it can possibly be helpful for another service member or another veteran. So I ask that you share it with them, because at the end of the day, that's really what all of this is about. One veteran trying to help another.